Femina Audio presents Sex Without Pain, a self-treatment guide to the sex life you deserve. Written and read by me, Dr. Heather Jeffcoat. Be sure to look for your bonus PDF that includes images I'll be referencing in the audiobook, as well as other great resources. Hey, it's your friend, Dr. Heather. I just wanted to take a moment to personally welcome you and acknowledge you for taking the next steps to a more fulfilling sex life. Sex Without Pain is a guide designed to empower you, guide you, and provide you the tools so you can start having the sex life you deserve. Introduction. Frustrating, confusing, devastating. These are just a few of the words women use to describe pain during intercourse, a condition that affects far more people than you might imagine. Even the medical profession is still coming to terms with the scope of the problem. It's been less than 10 years since the American College of Obstetricians and Gynecologists, also known as ACOG, issued a position statement noting 3 out of 4 women will experience painful intercourse at some point in their lives. They now recommend physical therapy as one treatment option. The first edition of this book revealed that game-changing scientific truth well before ACOG published their statement. But it doesn't just happen after delivering a baby. The onset of painful intercourse can occur at any stage of a woman's life, from your first sexual contact, after an injury or infection, after surgery, or not until menopause. And the why it started may be due to another reason entirely. If you or your partner are struggling in this area, please keep listening. The answers you've been looking for are here, and to find them, you won't have to sift through confusing medical jargon or humiliating suggestions that your problems are all in your head. My promise is to keep things simple and get to the heart of what matters most to you, getting better. Although I have included some of the why of this widely misunderstood condition, this is primarily a how-to book, and the reason is simple. Pain during intercourse is often a physical problem that is misdiagnosed as a purely psychological one. Of course, there are psychological considerations. If you experience pain every time you have intercourse, how can it not get into your head? But in my professional experience, the problem seldom starts there. Being crazy isn't causing your pain, but the pain can make you feel crazy. The information in this book has helped many women break that cycle, and I'm confident it can do the same for you. But because trust is such an important factor in healing, let's start with a bit of information about me. I'm a physical therapist with more than 2 decades of specialized professional experience in treating women with pelvic floor muscle disorders. Patients and even fellow medical professionals often ask me the same question. How did you decide to do this? When I started my physical therapy training at Duke University, I thought I wanted to specialize in pediatrics. As I continued my studies, I also explored the worlds of general orthopedics and sports medicine. While at Duke, I was fortunate to have ongoing exposure to the new and growing field of women's health physical therapy. I loved the one-on-one interaction with patients it provided, as well as the opportunity to work with an extremely underserved patient population. And ultimately, the idea of being able to help people with such personal issues seemed truly rewarding. As I began my practice, I quickly realized how little the larger medical community actually knew about pelvic floor conditions that can lead to pain during intercourse. Suddenly, I had a mission to educate physicians, nurses, psychologists, and other specialists about how common and how treatable these conditions are. I'll be honest, I've experienced some pushback from some members of the medical community, and maybe you have too. But I'm happy to report that a growing number of physicians, nurse practitioners, and counselors have been open to treating women with these conditions with great success. These trailblazers have become part of my close-knit personal and professional community, and the results for our patients have been amazing. Over the last several years, my practice has evolved. I am now privileged to focus primarily on women with pelvic pain and participate in research studies for women with sexual pain and dysfunction. If you experience pain during intercourse, I firmly believe the guidance of a trained women's health physical therapist is the best way to achieve maximum results. So why did I write a self-treatment book? If you've been looking for help for any length of time, you probably already know the answer to that question. Sadly, despite the progress being made, practitioners like myself are still few and far between, and we're flooded with requests or referrals.
Sample complete. Ready to continue?